Phase 4 of EMDR therapy, and this is desensitization. When people say EMDR therapy, this is normally what they're thinking of, okay? This is when we start the eye movements or the tactile taps like this, okay? Or some people like sounds. They wear the headphones, beep, beep, beep. This is all called bilateral stimulation, okay? And what it means simply is one side of the body, then the other. So the eyes moving back and forth, one side of the body, then the other. The taps, one side of the body, then the other, okay? The beeps, one side of the body, then the other. Greatest part about all this is, as the client, you don't need to know or understand it, because in an ideal world, your therapist does, okay? So this is where we have just done phase 3 of EMDR therapy. Your brain is fired up and ready to go after a memory and process it. And then we bring it all together, start the bilateral stimulation, and the magic begins. Okay. Now, just like phase 2, this can be very quick. Some people's brains take all that information, it all together, and resolve very quickly. Or this might last 4 months if the brain starts connecting to a bunch of different memories, okay? There is also the chance that when you start this, the therapist might realize that it's not going like they thought they had, and they hadn't done enough preparation in phase 2. And you kind of go back and do some more prep and get ready to have your system succeed at EMDR therapy. This is also the phase that clients tend to get the most anxiety. And I will say this to you about the anxiety. I, and in an ideal world, the therapist sitting there with you has complete faith that your system knows what it's doing and that your system is primed for healing and always wants the best things for you once it's able to get there. Okay. That being said, as long as the preparation is in place and your therapist skill level is at where you need them to be, this is gonna go well, okay? You just need to give the most honest feedback you can. If you feel like your nerves are getting in the way of being able to do what your therapist is asking, just tell them, because guess what? You might write an EMDR target about that. Isn't that neat? So basically, you're there. Hopefully at this point, you found a therapist that you trust and you're able to be open with, and you're able to just give them the feedback that's there and let your system do its thing. Okay, hit me up with any questions. Phase 5 coming up next.